All right, yeah, I think let's talk a little bit more about hyperconsumerism. Let's take for an example optometry. You know, for years, you would pick up your phone and you would call the optometrist or the ophthalmologist office to get an eye exam, for an example. Typically, on average, that takes a week to 10 days to get an appointment. So you would get on the phone and you would negotiate with an optometry or an ophthalmology practice to encourage them to let you in so that you can spend money with them. Once you get there at an inconvenient time, a week later, you sit in their exam room on average for 45 minutes. Some studies suggest even longer, despite the fact that recent studies say that if a patient waits more than 15 minutes to be seen in an exam room, they go from liking you to not liking you. Then you get into the exam lane and you get your eyes done. And then, of course, the final episode of that experience oftentimes is what I call the cashectomy, right? You get sold Gucci glasses that you didn't want. That's historically what optometry and ophthalmology eye exams look like. Now, I've been in ophthalmology and optometry for years. I have tremendous respect for optometrists and ophthalmologists, and I think that they do amazing work. But unfortunately, a new app came out called Opternative. And Opternative, I now believe, is licensed in most states to be able to hold your cell phone up. You take a look at your screen and you do an eye exam with your computer in about the time it takes for you to beg the optometrist practice to let you come in 2 weeks to spend money with them. Really, isn't that interesting? And what happened here? And why is it so popular? In fact, they receive a 98.6% happy customer rating. 98.6% of those customers of this solution love the approach. Now, I'm far from advocating this, but I'm also bringing this out to really talk about what's happening. Why is that approach displacing medical practices with an app? Well, the answer is patients are consumerized. During COVID, they would press a few buttons on Amazon and everything that they could ever imagine shows up at their front door. In some markets the same day, and other markets typically the next day. They put a few more thumb movements on their phone, their groceries are at their front door. They have been taught to believe that a consumer experience should be beautiful, relevant, and friction-free. And that's what we're doing with healthcare. They simply took advantage of the fact that people did not want to go through the friction of waiting to get seen, waiting for an hour once they got to an optometric practice, only to get an update on their contact lens prescription. Now, again, I believe very strongly that anybody that needs to get an eye exam should get a real eye exam with a real optometrist or ophthalmologist. Because we want them to be in front of a slit lamp, we want them to get tonometry and so on. But in certain cases where there isn't counter-indicational reasons, it can elongate a prescription, for an example, for spectacles or contact lenses, as I understand it. Again, not advocating in this, but what I'm suggesting here is that a marketplace, optometrists and ophthalmologists, are regularly losing opportunities to serve patients because of a connected device. Well, that has expanded so much that it is really incredible. Let me give you another example. You know, I have 4 kids, and 3 of my kids had got braces, dental braces to straighten their teeth. I think it's a law that you have to have straight teeth with your kids. And so they went to an orthodontist, and the orthodontist charged $7,000, but there was another part of that relationship that was a little off for me. I had to agree to show up at his office 35 times for him to adjust the braces on their face in order to give them straight teeth. Well, a whole industry was created during this time of disruptive innovation in dentistry to create this new market segment of orthodontics. Well, that was until Smile Direct Club and other organizations came and said, well, wait a minute, why don't you just call us? We'll send you this impression kit. You make impressions, then we'll send you clear aligners, and your kid can do this. You don't have to come in ever to the dental office, and you don't have to pay $7,500. We'll only charge you $2,500. Less money, zero friction. It was a no-brainer. It's a no-brainer for most parents. And as a result of that, it's really displaced a lot of practices. And I think that ultimately it will change the practice of orthodontics. Because if we can get our kids' teeth straight and have the same clinical outcome for a fraction of the friction and a fraction of the money, I can't help but to think that that's going to make some big changes. So hyperconsumerism is affecting virtually everything. Let's take a look at some other examples. I mean, in the case of hearing aids, it used to be that you'd get in your car after making an appointment to see an audiologist, and you would go into the audiologist and they would do some simple assessment, and then they would prescribe a hearing aid. Well, that was a long process. It had a lot of friction. It was expensive. And as a result of that, new technologies like Eargo came out. And Eargo provides a very similar solution to Smile Direct Club in dentistry by providing hearing aids that are FDA approved and really top-notch technology just by picking up the phone and calling their customer service department. What we're really seeing in hyperconsumerism is the reduction of all things friction. And we really need to do friction assessment. What can we do to reduce the pain and the friction and the irrelevancy in the way in which we deliver value to our customers? And really maybe have that mature self-dialogue with ourselves about the fact that, we really do sell even though we're saving lives, right? And we have important stuff we're selling. At the end of the day, we really are selling a product, and that product has to be relevant. The pricing has to be transparent. It has to have a high degree, oftentimes, of customization. It has to be presented to consumers in a way that's relevant to their persona. We have to serve them not just in one monolithic experience. We have to serve them across 5 well-defined customer touchpoints across their clinical or surgical journey. And we have to map that out to understand how we can make it better. In fact, the best organizations are doing 3 things. They're developing thoughtful personification descriptions of the patients they serve so they can understand their needs, problems, and opportunities. They're also doing journey mapping, where they're looking at the pre-touch moment, the first touch moment, the core moment, the last touch moment, and the in-touch moment. These are the various 5 touch points that consumers engage us with. And we need to make those experiences beautiful and well above the baseline level of their expectation. When we do that, we can really win at hyperconsumerism. Well, that's a great question. One of the challenges that we have when we think about consumerism is we really look at it with a sort of historical bias. We assume that, consumerism is better waiting rooms, and we assume that consumerism is an app and things like that. And the problem is that most organizations in healthcare really don't tend to see the vastness of the change within consumerism. So they result in really incremental innovations. They make incremental changes in a time of rapid environmental change. And of course, it doesn't square up very well. So I believe that the way to address this is to start with what I call an SOS approach. And the SOS approach is start with a situational summary or situational analysis of where are you right now? What is your current level of satisfaction? And I would go beyond using your traditional promoter score data or certainly your patient survey data. It's just not good enough anymore. We need to deploy a wide range of new methods to be able to get far better insights if we want to fix the problems, improve our HCAHPS scores, improve the way in which we serve these amazing patients. So the way we really do that is through a range of better insights that go beyond the survey score. One of the ways to do that is through what I call a patient hackathon. And I will provide a PDF of how to conduct a hackathon so that you can apply this in a really practical way. But you bring your patient-facing stakeholders together, you bring your team together, and you go through personification, really understanding these different personas. We serve lots of different types of people. And unfortunately and historically, we would sort of pigeonhole people based on outdated, old-fashioned market demographics. But Today, we really need to realize that we need to understand who these patients are from the things that they love, the things that they want, and the things they hate, the things that they don't want. And if you break it up into what we now call hate-love personas, we can do a far better job of taking those insights and transmuting them into new innovations. And that's really what it means to be a CX innovator. Now, you can apply these same principles, in fact, should apply these same principles to the way in which you architect beautiful experiences for your employees as well. We need to realize that, if you've ever gone to a restaurant and had a cranky server or a cranky hostess, you can see that it's really hard for that restaurant to deliver a great experience if the people that are working there are unhappy or in pain. And yet so many of the stakeholders in healthcare are at the highest level of stress they've ever been. And yet we really haven't done the kinds of things that we need to help get them to a better place. So when we think about customer experience, most people do it fractionally. They look at it from a patient experience perspective, which means let's get slightly better than we used to be. If you look at it from a consumer approach, you realize that the bar is much higher and that we need to understand that they want new things. They want transparency, financial transparency. They want relevancy. They want customization. They want friction freedom. They want humanity. They want the humanity of the experience, not just the mechanics of the clinical care. They want the humanity of the experience. It's so important that we understand that and create new insights. So again, hackathons are a great way to go, but there's other ways to get insights as well that go far beyond surveys and far beyond the scope of what we can talk about today. But we have to start with that SOS approach, situational summary. What do we know about where the problems are, what our patients and stakeholders care about? Then from there, we need to set objectives. What do we want to do about it? Do we want to develop a matrix that we measure to improve our current state? And then the last S, of course, is what is that strategy and how do we deploy it? Situation analysis, setting key objectives, and implementing a smart strategy is the key to rapidly improving patient experience, rapidly improving employee experience. And leaders, here's something to keep in mind, is that this, if you do nothing more than just this, its impact to organizational growth is incredible. This increases, again, productivity, presenteeism. It increases patient attraction. It eliminates patient deflection. It improves your social ratings. It improves your ability to drive efficiency and reduce cost. Everything that we want to do as leaders come from the way in which we fundamentally address the substrate of our business, which of course is our customers, our patients, and the amazing stakeholders that serve our mission every day, our employees. If we can get that right, we are well ahead of the game in terms of being ready for chaotic innovation, in my opinion.